Hi, good afternoon. My name is Yoania. I'm gonna be your nurse practitioner today. What is your name?
Ignacio Medina,
Okay, and where are you?
at the clinic,
What day is today?
July 29, 2020,
And why are you here?
for a head to toe exam.
Okay, so I'm gonna perform a head to toe exam, and the first thing I'm gonna do is to check your head, your position, if the head is proportional with the body, and I'm gonna check the scalp for head distribution, any obvious lesion, any tumor, any mass. Okay, so now I'm gonna assess the lymph nodes, the preauricular lymph node, anterior, this part on the anterior ear, and the posterior auricular. And what I'm assessing here is the size, tenderness, and if the lymph node has symmetry. The tonsillus, which this is the mandibular board, is gonna be in the upper part down below the bone, the submandibular and the submental. Then the superficial cervical, I'm gonna locate the sternocleidomastoid muscle, so it's gonna be here superficial. The deep cervical, I'm gonna do like a hoop with my index and my thumb, and I'm gonna press deeper. The posterior cervical, and I'm gonna locate the trapezius muscles, and they're gonna be right here before the subclavicular. And again, what I'm assessing here with the lymph nodes is the symmetry, the tenderness, and the size of the lymph nodes. And I'm gonna assess here the epitocleum, which is where the biceps and the triceps meet right before the elbow articulation. So now I'm gonna perform the eye exam, and while performing the eye exam, I'm gonna start assessing the cranial nerve number 2, which is optic. So for that, I'm gonna start by a visual field. To assess for a visual field, I'm gonna place a Snelling chart in the wall, and I'm gonna have the patient 20 feet apart. I'm gonna have him cover one eye while reading with the other eye, and I'm gonna have him repeat with the other eye. If he misses 1 or 2 letters, the way I'm document this is 20/20 minus 2, 20/20 minus 1. Then I'm gonna check the visual field. To assess the visual field, I'm gonna length arm apart the patient from me, and I'm gonna have him cover his left eye, and I'm gonna cover my right eye. I'm gonna place my fingers lateral to his ear. I'm gonna wiggle the fingers. I'm gonna ask the patient if he see my fingers.
Yes.
Up and down and towards him, so I can cover all the peripheral vision. I'm gonna do the same with the other part of the peripheral field. Then I'm gonna check, I'm gonna do a fundoscopy. I'm gonna do a fundoscopy on his right eye with my right eye and my right hand. So I'm gonna darken the room. I'm gonna light on the ophthalmoscope, and the first thing that I'm gonna see is the red reflex. And I should approach the patient and should follow the red reflex until I see the vessels where the arteries are gonna be pink and thinner, and the veins are gonna be darker. And I should continue looking to the vessels until I see the optic, the optic disc. Then I'm gonna assess for cranial nerve number 6, which is abductor, which is responsible of the lateral vision. I'm gonna ask the patient to look lateral without moving his head to the other side. Then cranial nerve number 4, which is trochlear, which I'm gonna ask him to look down inward. And the cranial nerve number 3, which is responsible for oculomotor, which is responsible for all other movement. Yeah. And I'm gonna have him look to the far point in the ceiling, so I should see how the pupil dilate. And I'm gonna ask him to look to a closer object, so I should see how the pupil constrict. Then I'm gonna check the pupillary reflex with a pen line, and I should see how the pupil constrict, while the other eye, the pupil constrict as well. So now I'm gonna assess the nose. So I'm gonna assess the nose, if it's symmetry, any discharge, and I'm gonna check for cranial nerve number 1, which is olfactory. So I'm gonna have him cover one nostril, and I'm gonna give a non-irritant substance so he can smell with his eye closed, so he can identify. I'm gonna repeat the other nostril with a different substance. Then I'm gonna check the mouth for any cracked lips, if any lesions, if symmetry. I'm gonna have him open his mouth. I'm gonna check inside the mouth for the mucosa should be pink and moist. I'm gonna assess cranial nerve number 9, glossopharyngeal. I'm gonna give him something sweet and sour so I can test for the taste. and also the gag reflex, which I'm going to assess the gag reflex with a tongue compressor. So cranial nerve number 10, with the vagus, I'm gonna have it open, say I'm gonna check for the soft and hard palate and the uvula. So while he's saying the soft palate should raise and the uvula should be in the middle. Then the cranial nerve number 12, hypoglossus. So the tongue should move to the sides. And cranial nerve number 11, which is accessory, and I'm gonna bruise so he can force his shoulders up. Then I'm gonna set the thyroid. To set the thyroid, I'm gonna inspect the thyroid. Not any obvious mass. I'm gonna press, and I'm gonna have the patient to swallow, and I should see the thyroid cartilage go down and up. Then I'm gonna start with respiratory of the ear. I'm gonna assess the ear. I'm gonna check the ear. No obvious lesion, no mass. So I'm gonna pull up and back, and I'm gonna check with the otoscope. With the otoscope, the ear canal, the external ear, the tympanic, and I'm gonna assess the vestibulocochlear ear. So I'm gonna step back to the patient. I'm gonna have him cover one ear. I'm gonna whisper, and he should tell me what he's hearing. And I'm gonna perform the same with the other ear and a different words. So I'm gonna assess the cranial nerve number 5, trigeminal, and I'm gonna have assess here. So he should feel
Soft or
soft. Okay, so I'm going to assess the respiratory assessment. So have you been shortness of breath, congested?
No.
No, okay. So I'm gonna inspect the chest for any unlabored respiration. So I'm going to assess the thoracic expansion. If you can please be in your back. So to assess for the thoracic expansion, I'm gonna locate where C7 is, and I'm going to count down to T10. When I get to T10, I'm gonna place my hands like this with one inch in between. I'm gonna ask the patient to take a deep breath, and should be an equal expansion. Now I'm gonna assess for tactile remedies. So I'm gonna have the patient say 99.
99.
I'm gonna check that with the owner of my hand
99.
going down,
99.
and should be equal vibration. And I'm gonna do the same on the anterior part. Then I'm gonna do percussion. So percussion, I'm gonna do with the placed finger. So I'm gonna place the finger. I'm gonna place the finger in between the intercostal space, and I'm gonna go louder, partner. And now I'm going to auscultate. The auscultation should be also in the louder part. If you can please deep breathe. Now I'm going to assess vocal resonance. To assess vocal resonance, there is 3 ways. One is bronchophony, which he's gonna say 99 while I'm auscultating.
99. 99. 99.
And I should hear a more for 99. So egophony, he should say, I'm sorry, E.
E. E.
And I should hear a more for E.
E.
And a whisper ventriloquist that he's gonna whisper numbers, for example, 1, 2, 3.
1, 2, 3. 1, 2, 3.
And I shouldn't hear anything. Now if you can please turn. And I'm gonna do the same in the anterior part. So now I'm gonna assess the cardiovascular assessment. Have you been shortness of breath, chest pain?
No.
Any history of hypertension?
No.
Any sudden death in your family?
No.
So I'm gonna inspect the chest for any birthmark, any lesions. So I'm gonna have him laying down with the head of the veil elevated 30 degrees. And I'm gonna have him tilt the head to the left side, and I'm gonna check for the jugular venous pulse. And I'm gonna place the pen light tangential. And what I'm looking at is for the point of maximal oscillation. If I see that anything is wrong with the point of maximal oscillation, then I'm gonna assess the jugular venous pressure. To assess the jugular venous pressure, I'm gonna place a ruler parallel to the wall in the angle of Lewis with another ruler 90 degrees, and the measurement should be less than 3 centimeters. Then I'm gonna check if you can go to the left. I'm gonna assess the point of maximal impulse. So the point of maximal impulse should be in the mid-clavicular line, 5th intercostal space, and should be a measurement of 2.5 centimeters. If it's more to the right, it's gonna be indicative of, I'm gonna have a differential of right ventricular hypertrophy. If it's more to the left, I'm gonna have a differential of left ventricular hypertrophy. Then, if you can stand. So I'm gonna assess the valve. I'm gonna start by the aortic valve, which is in the second intercostal space, right sternal body. The tricuspid is in the second intercostal space, left sternal body. Left sternal body. Tricuspid is going to be in the fourth intercostal space, left sternal body, and the mid-clavicular line, 5th intercostal space, is going to be the mitral. Then, okay, next I'm going to assess two sounds. There is two normal sounds, S1 and S2. S1 is best heard in the apex of the heart, okay, and S2 is best heard in the base of the heart. So there's also S3 and S4, which is abnormal heart sounds. S3 comes after S2, and S4 comes right before S1. So there's also the murmurs. So the murmurs, we first need to locate where the murmur is. If it's in the aortic, tricuspid, mitral, and pulmonary valve. After we know that, we need to know if the murmurs occurs during systole, and that should be a regurgitation problem, or is during diastole and should be a stenosis problem. Now I'm gonna assess the carotid for any fluid with the bell of the diaphragm. And then now I'm gonna assess for the peripheral vascular assessment. So I'm gonna start for in the upper extremity. I'm gonna check the skin for any lesion, skin temperature, turgor. I'm gonna assess the pulse, the brachial pulse, the radial pulse, and I'm gonna assess also the capillary refill, and should be less than 3 seconds. Then I'm gonna repeat the same with the other arm, and I'm gonna check now the lower extremities. I'm gonna check for hair distribution, skin temperature, skin turgor, and I'm gonna check the pulses. If you can please stand. I'm gonna check for the femoral pulse. It's gonna be here at the level of the pubic. The popliteal area is gonna be right here, the popliteal pulse. The posterior pedals, tibialis, and dorsalis pedis. Then I'm gonna check the abdomen. If you can please lay down. To assess the abdomen, I'm gonna chest inspect, then auscultate, palpate, and percuss. So I'm gonna inspect the abdomen for any obvious mass, any lesions, any birthmark, any scar surgery, anything like that. If there's nothing like that, I'm gonna auscultate, and I'm gonna begin by the right upper quadrant. And I'm gonna hear the vowel sound for 1 full minute. They should be active. In the right lower quadrant, left lower quadrant, and then left upper quadrant. So now I'm going to palpate a light palpate with the palm of my hand, okay, the all 4 quadrants and the gastric area. So I'm gonna deep palpate in the all 4 quadrants and the gastric area, and then lastly I'm gonna percuss. Then I'm gonna assess the sensory exam. You can please sit. The sensory exam. So this is gonna be soft and this is gonna be pinch. So close your eye and you tell me which one is soft.
Soft. Pinch.
Okay, then I'm gonna do the reflex, the ankle reflex. You can please face the wall. And I'm gonna stroke here in this part so the ankle should flex. Then I'm gonna perform the patellar reflex. You can please sit back so the legs can be suspended. I'm gonna touch here the like a spongy area, and I'm gonna hit with the hammer, and the leg should go up. Then I'm gonna do the tricep reflex. So I'm gonna grab his arm here, and I'm gonna hit here in this part of the arm, and the arm should go up, and the brachial. The biceps. I'm gonna put my finger, I'm gonna hit up in my I'm gonna hit in my fingers, not in his arm. And the brachial radialis is gonna be right here, like 2 centimeters up to the radial post, and the wrist should flex. Then I'm gonna assess I'm gonna do the Weber test. So to do the Weber test, if I do the Weber test, it's a whisper test if I see that anything is abnormal. So I'm gonna use the tuning fork. So I'm gonna strike the tuning fork, I'm gonna place it here, and should be equal vibration to both ears. And the Rhine test, I'm gonna put it in the temporal bone, and I'm gonna ask the patient to let me know when he stopped hearing. And I'm gonna put it here, right to his ear, and he should continue hearing.